Hello friends, my name is Dr. Jyoti Gupta. I am an IVF consultant and center head at Indira IVF Faridabad. I hope you all are taking very good care of yourself and are staying at home and taking all the precautions that are needed in these times of COVID. Just stay home, stay safe, stay healthy. Today, in the continuation of our videos where we try and give you information about certain important aspects related to infertility or assisted management of pregnancies, I hereby will talk about today. We'll talk about a very, very important question that is very frequently asked of me. Ma'am, how many IVF cycles are needed to get a successful pregnancy? This is a very common question that we are frequently asked, and let's today try and find out the real answer to it. So, before you understand how many cycles does it take to become pregnant, it does not entirely depend upon the number of cycles. It depends upon a number of factors involved in it. First, you need to be evaluated by your doctor as to what your real problem is. What is the reason that you're not conceiving? The reason for not being able to conceive or the cause of infertility is very important in determining how many number of cycles it may take to give you that pregnancy. So a right evaluation in right hands is something which is absolutely essential in terms of a number of factors. When we evaluate you in terms of infertility, we try to evaluate you in certain aspects like the quality and quantity of your eggs, or what we call as egg reserve, the quantity and quality of the semen parameters, and the uterus and the endometrium, whether the endometrium is irregular or regular, whether it is properly formed, whether it has an adequate thickness or the blood supply, what is the shape, size of the uterus, whether there are any mass lesions or any problems inside the uterus. A number of factors need to be evaluated before we reach to a conclusion as to how do we plan your pregnancy. So first thing, as I said, is the reason involved in not being able to get pregnant. Second, once the evaluation is done, it is important to find out what is the course of action now? I mean, what is the plan of action for you? It is again very important because the plan of action is again not decided entirely only on the basis of your age or the duration of marriage, as most people think. It is based largely on the reason for not being able to conceive, because there are many treatment options that you can undertake for infertility, like you can undergo ovulation induction or maybe IUI or IVF. So many people are of belief that IVF is needed only and only if the duration of marriage is long or if we are very old enough and we've tried all the other options. That's not the case. The treatment option, as I said, depends on the reason for not being able to conceive largely. So if you have a genuine problem, even after 2 years of marriage, we may guide you towards IVF. If there is no genuine problem and we think that you still have time in hand, even if you're married for say 6 years or 7 years or 8 years, we may still ask you not to undergo IVF. So all this depends upon what is your problem and what plan is being made. After the plan is made, how the plan is executed is again one way to find out how many cycles will it take for you to conceive, like using the right techniques, choosing a right center, choosing a right skilled and qualified doctor. All this is important in bringing about a successful pregnancy. Some people come to us after a number of IVF failures and are very disappointed, obviously, for the reason that they have tried enough, they've been trying, they've been doing all that they can do, and still the only result is failure. So we need to understand in such cases, are the right techniques being used? One patient may need a completely different set of techniques and the other patient may need a completely different set of techniques, depending upon what are the reasons for not being able to conceive and what is the plan of action for the concerned patient. So do not compare your treatment with other patients or people nearby or your relatives or your friends. Your doctor is the right person to tell you what your treatment should be. So if the right approach is carried, the right techniques are used, the right lab is used for handling gametes, the right procedures are being done, the right instruments are being used, as I said, under the right guidance, a right doctor and a right center. So all these parameters are important to decide your success rates for pregnancy. Generally, If all these things are taken in mind, one cycle of IVF may give you a result as good as somewhere between 60-65% to maybe 70-75% also. So there are many people who come and say that first cycle is a trial cycle. Most of the people do not conceive in the first cycle. That's not the case. There are many people who will conceive in the very first cycle if the right measures are taken. But yes, this is absolutely true that not everybody will conceive in the very first cycle. There are people who will require another cycle, another shot. There are people who require 3 cycles also. Usually, the cumulative success rate with the right measures in 3 cycles is close to, or I would say more than 90%. Most of the people with the right approach usually conceive in the first 3 cycles of their trial. Many conceive in the first cycle itself, some people conceive in the second, and usually many of the people will conceive in the third cycle. So again, as I said, IVF is not something, or science is not something where we can judge things on the basis of 0 or 100. It's not like all or none phenomena. So yes, there are some people who may need more than 3 cycles also, but that's generally not needed for the population. Like only say 5% of the people would need more than 3 cycles. Most of the people, 5 to 10% maybe, will need it. Most of the people with the right approach will usually conceive in the first 3 cycles. So, as I said, there are important points which need to be considered before understanding the fact what is your success rate, what is the right way to move ahead, and how many cycles will it take. When we talk about the right ways to move ahead, there are certain things we need to understand. As I said, evaluation is obviously important. Understanding the cause of not being able to conceive is absolutely important. When we find out the plan that will work for you, certain technologies are something that you need to discuss with your doctor about, like whether your IVF, if being undertaken, will it be a fresh cycle or a fresh transfer, or will it be a frozen transfer? Different people will need different type of cycles, and generally with self eggs, the success rate of frozen embryo transfers is much higher compared to the fresh transfers. So there are people who fail just because the right type of transfer is not being done. Another aspect which needs to be understood is what is the day of the embryo transfer. That is again very, very important, and important in understanding the success rate also. Whether we are transferring an embryo on day 3 or is it a day 5 transfer. Day 5 transfer is the blastocyst transfer. Blastocyst culture is known to have better success rates because they are better selected embryos, they are chromosomally more competent embryos, and thus they increase the success rate. That is again something that you can discuss with your doctor, and the right decision can be taken in your case. Some people may have certain genetic issues, or because of advancing age, there may be people where only an embryo which is formed and is transferred is not good enough for pregnancy. The embryo also needs to be evaluated genetically because of the changes that may happen because of increased advanced maternal age. So there are certain techniques, like there is a technique which is called as PGTA, pre-implantation genetic testing for aneuploidy. So that is again something that you can discuss with your doctor. And if required in your case, as I said, every technique is not required in every patient, but yes, some people will require this kind of intervention to be taken. So in case PGTA is required in your case, you can discuss that also with your doctor. Or supposedly there is a history of some genetic disease running in your family, or there's a personal history of this kind. Again, such kinds of evaluations will help in the better implantation of the embryo. Some people may need some other kind of interventions like laparoscopy or hysteroscopy. Again, that is not something which is needed in all the patients, and also which kind of patients will require this again depends upon the problems that you're facing or the evaluation that has been done by the doctor. So you can discuss these aspects again with your doctor. Like hysteroscopy is needed in certain cases where the endometrium is not very good, whether if the endometrium is thin or it is thick, very thick or very thin maybe, or there are certain changes inside the endometrium, there are adhesions or there are polyps, or there's something that your doctor is not happy about. It doesn't look like a good endometrium. The doctor may want to evaluate you by doing a hysteroscopy so as to see what can be done in your case. Laparoscopy may be required for certain people, like if there are large fibroids in your uterus, or there is water inside your tube, which is called as hydrosalping. So different people will require different approaches for attaining pregnancy. So not everybody will require everything, but this is an important piece of information. All these technologies need to be discussed with your doctor, and thus, as I said, if the right evaluation has been done, the right approach has been taken, the right technologies are being used, the right injections are being used, the right center is being chosen, and the right doctor has been chosen, your success rate will definitely increase. I hope this information was useful to all of you, and now you understand how important it is to evaluate your pregnancy, evaluate your case properly. And as I said, usually in the first cycle, around 60, 65, maybe even 70, 75% people will conceive in the right with the right approach. Other people will conceive in the second cycle, and the cumulative pregnancy rate within the 3 cycles is usually around 90%. Sometimes even more. Many people will conceive in the first 3 cycles. Although yes, there are people, some people would require more than these number of cycles, but that depends again on the case to case variations. What are the problems being faced? How are the problems being tackled? What can science offer you in terms of the problems that are being faced by you? You can discuss all this with your doctor, and I'm sure your doctors will help you. So I hope this piece of information was useful to you, and we'll keep coming up with such videos for your knowledge and awareness. For this time, it's a tough time of COVID. Just stay home, stay healthy, stay take all the precautions that are being told to you by the government, by the health agencies. Keep your masks on, and I hope that you take due care of yourself. Take very good care of yourself. Stay happy, stay healthy. We'll meet again. Keep watching our videos. Thank you for watching.